Hello and welcome back to the Patient First podcast, where we, of course, put patients first. Now, that might sound very obvious that the Patients First podcast, we put patients first, but we're shifting formats. We just had our annual meeting here at Upgrade Dental and made some sort of clear decisions based on some obvious facts that make focusing on putting patients first so much more obvious than ever before. What did we find out? Well, we did some research and some data and realized that lots and lots of patients are watching and viewing and listening to our podcast. Thank you, patients, for being here. We love having you here. Make sure to, let people know, like, subscribe, all that fun stuff. And some patients have reached out to me and they have questions about dentistry. And really got together with a team over at Upgrade Dental, and we realized that if you haven't read the book, The Patient First Manifesto, that's an Amazon bestseller, and it's been popular with patients too. Really realized that in the book, I talk about what I call the Great Disconnect, and the Great Disconnect is the sort of artificial barriers between the way patients view dentistry and the way that dental professionals view dentistry. And I talk a lot in the book about why this happens on our side, basically, what happens in dental school that takes well meaning dentists who really want to deliver. Dentists want to deliver the highest quality care that they can to patients. And to do that, frankly, we're working in my tiny, 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 tiny nanometers, right? And trying to achieve perfection, which we all know can never be, it can never be achieved. So really to work in sort of these demanding circumstances on patients that sometimes their tongue is flying around and we're dealing with materials and there's a timing issue and we have to there's a lot of variables outside of our control and so many variables that we have to try to control that it's a very challenging profession. So in addition to all of this sort of mechanical, technical art that we're trying to achieve inside a patient's mouth, it's attached to a human being, right? And in order do the best quality work that we can in dental school, we sort of learn to disconnect ourselves, dissociate ourselves from our patients. So we can, and it's really all well meaning. And we're trying to do the best for our patients, the highest quality care. But sometimes it can seem like we're dissociated from what the patient's thinking and feeling. And that over time leads to what I call the great disconnect. And unknowingly, here at the Patient Podcast, we've been communicating from that perspective. I've been talking directly to dentists, and some patients have been like, "Where do I fit in this equation?" And you know, historically in the podcast, we did a lot more of talking with patients, and we're going to do a lot more of that going forward, opening up the conversation because, look, I've said it many times on this podcast. One of the things that I love the most about the dental profession is that when done right, everybody wins. And obviously, everybody wins when we have open, transparent communication on both sides of the great disconnect, right? Where we can bridge that gap, bring patients, bring dental professionals together so that we can make basically everything better for everybody. And that's what this is all about. So, if you are a regular listener to the podcast, you might see a slight shift I'm going to be talking a lot more where I'm including patients into the conversation. What does that mean? Well, for example, I'm going to propose a couple questions that might seem like I'm talking to dentists, but, or might seem I'm talking to patients, but we can actually talk about both. So, first, something that might seem like it's dental professional related. What is the latest technology in dental implants, right? And we can talk about that and we can talk, and we can talk about CAD CAM and CT imaging and how to bring these together and implants and ceramic implants and all the great things that are going on in implantology right now. And it can seem like it's just for dental professionals. But when we start talking about the benefit to patients and the higher degree of success of one way versus another, the post-operative discomfort or the pain you have after the procedure, that is all obviously from the perspective of a patient. So they might learn, boy, I don't want to have an implant done this way. It might make sense for me to seek out a dentist that's doing it that way, right? Or even something that's simple like when does a tooth need a crown, right? Well, it might seem like that's like I'm talking to a patient because they don't know when a tooth needs a crown. However, if you talk to 10 dentists, they might actually give you 10 different opinions and to when a tooth needs a crown. So if we discuss it here, everybody can win. Hopefully, we can get more clear, or you can make, maybe you learn something, maybe I'll learn something based on your feedback. Maybe the patient learns something about when a tooth actually should have a full coverage restoration. And so, those are two examples of kind of questions that we'll be asking and attempting to at least give a perspective, maybe even an answer for you on those, which might seem like it's a shift in the type of questions that we answer here on the Patients Podcast, but it's really from the perspective of trying to raise the industry for everybody, get patients better care than what they have today, because that's what it's about. It's about putting patients first, right? And when we do that, everybody wins. The practice wins, the general profession, the dentist, the team members, and of course, the patients win. So, even industry news. I've been shocked. I was at a meeting this last weekend, entrepreneurial retreat with some great new people that I met. And I talk about being a dentist and in dental innovation. And I'm always surprised. And, the dentists who are out here, they probably have seen this, where so many people that aren't in the dental profession, they're just, people walking around planet Earth with teeth, that they're not in dentistry, but oftentimes they have an uncle or a friend that's in dentistry and they are just curious. And a lot of people are like that who have been listening to the podcast. So let's include them in on the conversation and give it, the perspective, not just from dental professionals, but from people with teeth, as my friend and colleague Nate on the team says. Let's talk to people with teeth, and I think that's very, people have been listening who aren't in the dental profession, and they've been asking questions, and so let's include them in the conversation. This is, like I've said 12 times on this podcast already, it is the Patient First podcast. I can't believe kind of I'm sitting here and I've unknowingly excluded patients from many of the conversations that we've been having. So, one last detail that I want to talk about on this podcast before we shift next week into our same format, but just sort of the content is going to be delivered in a little different direction and some of the more dental specific information. So, we have an ongoing segment here called Books Applied to Dentistry, where I take a popular business book or a book that's just, once I did a children's book, and I apply it to the dental profession. Going forward, content like that, that's just dental specific, will be over at upgradedental.com. So if you haven't checked out Upgrade Dental and you like that style of content, the KDIs, we'll still talk about some of those here where we take things that are going on large outside dentistry and applying it to dentistry. Not really the style of content that patients are going to want to listen to. So, and that's some of the feedback I've gotten from patients. So we are that style of content, which is going to be directly focused just at dental professionals, like taking something outside of dentistry and applying it to dentistry. We're going to continue those conversations along with tons of CE training, webinars that we already do. We do virtual events, the upgrade days, summits, where we have all sorts of great things. And if you're not on the list, make sure to go over to upgradedental.com if you're in the dental profession and sign up there. Otherwise, we're going to continue the conversation as always, as before, but with more focus on the great people that we get to serve within the dental profession that we call patients. And we're going to put them first, highlight them here on the Patient First podcast. And I don't know about you, but I'm really excited to open up those conversations and talk about things from patients' perspective much more. Thank you very much for listening. And next week, I look forward to seeing you again right here on the Patient First podcast.